What's the best way to stop hot flashes and other menopause symptoms? Hot flashes, night sweats, vaginal dryness, painful intercourse. Well, obviously, I've never experienced menopause symptoms personally, but I have talked to about 2,000 women who have, and it sounds absolutely miserable. Some of the women I've talked with have told me absolutely heartbreaking stories of how menopause has quite literally ruined their lives. I'm Steve Goldring from simplehormones.com. I help patients and healthcare practitioners with easy to understand patient education information. Resources that are mostly about hormones and hormone optimization. Stick around to the end of this video to learn more about what I call hormone optimization specialists. Those are healthcare providers with experience and expertise in optimal hormones. That is, making sure your hormones aren't too high and they're not too low, but they're just right. Well, a good friend of ours recently reached out to ask me what she should do about hot flashes specifically, along with not sleeping very well and a whole bunch of other life-changing menopause symptoms. In my last video, I talked about how hot flashes are probably the best thing that can happen to a woman in menopause. The reason I say that isn't because I'm an insensitive, misogynistic, mansplaining jerk. It's that I see lots of women without menopause symptoms who seem to sail through menopause without a care. But it's these women who end up with some really serious health risks, which I'll talk about in a minute. Hot flashes are a powerful warning sign that something's not quite right. They motivate women to make a change. The most effective treatment for hot flashes, hands down, is optimizing your estradiol. Estradiol is the most powerful and most important estrogen that's made by your ovaries. Well, at least your ovaries make estradiol up until you're about age 51 on average. After that time, they're genetically programmed to completely stop making estradiol. And that's the reason, that's the root problem that causes you to have hot flashes and a bunch of other menopause symptoms. Things like hot flashes, night sweats, kind of like hot flashes, except for they wake you up at 3 a.m. Weight gain, especially if you haven't ever had weight gain in the past and never had problems losing weight. Irritability, anger at your spouse or your kids, mood swings, confusion, brain fog, dry, itchy skin, maybe vaginal dryness and vaginal itching, possibly even painful intercourse. Urinary incontinence problems where you have leaking when you cough or you laugh. There are a bunch of other menopause symptoms like insomnia and depression and anxiety that are actually caused by the loss of some different hormones, and I'll have to talk about those in another video. As I've already alluded to, the loss of estradiol at menopause also puts you at serious risk for a whole bunch of long-term health issues. Things like your insulin, that's what moves glucose from your blood into your cells. Your insulin doesn't work as well anymore, and you get something called insulin resistance. Insulin resistance can actually lead to a serious problem called type 2 diabetes. Low estradiol makes your bones hollow and weak, and you can eventually get osteoporosis. And that could land you in a rehab hospital or even a nursing home after a broken hip or a broken wrist. Low estradiol makes it much more likely that you're going to develop cognitive decline and even Alzheimer's disease. It also makes you much more likely to get heart disease. I have a whole different video about that. It's the #1 killer of women over 50. In fact, after 50, heart disease kills 10 times the number of women as breast cancer does. Getting your levels of estradiol just right, as I mentioned, not too high, not too low, but just right. That's the key to eliminating a long list of menopause symptoms. Optimal estradiol is also a key, along with diet, exercise, and optimizing some of the other crucial hormones, to having long-term health and wellness. Well, here are the 6 most important things that you need to know about estradiol. First, estradiol relieves menopause symptoms. Oral or transdermal estradiol can relieve hot flashes and night sweats. It helps with weight gain issues. It helps to reduce mood swings and irritability. It can also help with heart palpitations that some women get at menopause. Estradiol that comes in a vaginal cream form can reduce vaginal itching and dryness. It can also reduce painful intercourse and help with urinary incontinence issues. Estradiol does have some side effects. The most common of those side effects is breast tenderness, and that's almost always a matter of dosage. If your estradiol dose is too high, you might have breast tenderness. If your estradiol dose is too low, you'll have hot flashes. That's assuming that you're taking an external estradiol capsule or tablet or patch. Well, there are some women who are at risk for blood clots. If you've had a serious blood clot, especially in your legs or your lungs, sometimes they call them pulmonary embolism or deep venous thrombosis, in that case, it's best to use a transdermal estradiol patch or a cream rather than a tablet or a capsule, sometimes called an estradiol pill. A provider who really knows what they're doing knows how to handle that risk of blood clots, and it doesn't happen in everybody. Number 3, you have to have a prescription for estradiol. That means you'll need to have a licensed healthcare provider to get estradiol in your system. You can't take an herbal supplement or change your diet or exercise in order to increase your estradiol. So no matter how many people say you can balance your hormones naturally, you simply can't reverse the genetic programming of your ovaries and make them start manufacturing estradiol over again after you've gone into menopause. If you have some type of valid scientific proof that I'm wrong about that, I'd love to see it. I don't think there's much around. That's not to say that you have absolutely zero estradiol after menopause. Your uterus and your fat cells and some of your skin cells may also make some estradiol, but the amount of estradiol that comes from those is really, really negligible. It's tiny compared to what your ovaries used to make before you went into menopause. Number 4 is estradiol should always be given along with oral micronized progesterone. And I'll talk about progesterone in another video, but it's a very important hormone. What you need to know about it right now is that estradiol should always be given along with progesterone. And that holds true whether you have a uterus or not. Some providers assume that you don't need progesterone if, for example, you've had a hysterectomy and they've taken out your uterus. But that's an old way of thinking that doesn't take into account all the evidence. It also treats only some of your menopause symptoms and leaves you hanging when it comes to sleep, depression, and anxiety. So be sure if you're taking estradiol to also make sure your doctor gives you progesterone along with it. The 5th thing to remember about estradiol is that not every provider is comfortable prescribing it. My friend Stacy, who contacted me recently, said that a nurse practitioner took her off of estradiol because she didn't like it. Unfortunately, that's extremely common. The conventional wisdom says a couple of things about estradiol and hormones in general. Conventional wisdom says that hormones cause breast cancer. It says hormones increase heart attacks in women. And it says hormones should only be given for 5 years or so after menopause. Well, the basis for these pieces of conventional wisdom is mainly a big study called the Women's Health Initiative. The WHI influences a lot of doctors who've never really looked closely at it, but who live by that conventional wisdom. The 6th thing I want you to know about estradiol is that the scientific evidence contradicts a lot of that conventional wisdom about estradiol. There's really overwhelming evidence that estradiol doesn't cause breast cancer, although it may have an influence on breast cancer. You have to think about the fact that millions of women have high levels of estradiol throughout their lives ever since they're 12 years old, and they don't all get breast cancer. Estradiol also doesn't increase heart attacks in women and probably prevents them, as long as it's given early in menopause before heart disease has a chance to really take hold. Estradiol helps to prevent long-term health risks, as I've mentioned, and that means that it should be maintained at optimal levels for the rest of your life. Not too high, not too low, but just right. People in general tend to hold on to what they believe is true and deny any new evidence that kind of contradicts what they already think. And that's exactly what happens with doctors who haven't really evaluated all the evidence about estradiol. Well, there are really 2 ways to get your levels of estradiol, what I call, optimized. The first is you can ask a doctor that you're thinking of going to or one that you already have a relationship with about their view on hormones. If they seem open-minded and maybe they're familiar with the evidence about estradiol, go for it. If they're hesitant or they only seem to know the conventional wisdom based on the Women's Health Initiative, you might want to proceed with caution with that provider. You can also look for a hormone optimization specialist. That's a provider who has experience and expertise in menopause and in optimizing hormones for both men and women over 50. I happen to work with hundreds of hormone optimization providers. I might be able to give you some recommendations. There's no guarantees, mind you, but I can take a look at my database. If you're interested in finding a hormone specialist somewhere in your area, somebody who really knows about optimizing your estradiol, click the link on this page and I'll get your name, your city, and your zip code along with your email address. I'll let you know if there's a specialist somewhere close to you. I'll also be sending you some emails about hormones and menopause that I hope you'll find helpful. Take a look at my other video about estradiol and preventing heart disease that's linked at the end of this one. I've also linked to a video from somebody named Angie at Hot and Flashy that tells her experience of going off hormone replacement therapy. She doesn't specifically mention estradiol, but there are some lessons in her experience that I think would apply if you were on estradiol and you're thinking about getting off of it. Thanks so much for watching, and we'll talk again soon. Be sure to like this video and subscribe to my channel if you get a chance.